Once again, thank you so much for taking the time to join us today. From the Legislative Building in Regina, we have Saskatchewan's Chief Medical Health Officer, Dr. Saqib Shahab. As well on the phone from the Saskatchewan Health Authority, we have CEO Scott Livingstone. We'll start with opening remarks from Dr. Shahab, and then we'll take questions.
Thank you. So I'd like to start off by commending all parents, children, teachers, and school administration and staff for a very successful return to school this week. This was a significant undertaking, one of the biggest sectors that is reopening, and was actually its own reopening sector. And while obviously all of it had a lot of concerns, having a low community transmission that we currently have in Saskatchewan has really supported a safe school reopening. And we will continue to monitor and work with schools, and obviously continue to look at what further preventive measures are required to keep our case numbers low, both at the community level and within schools. And this really underlines why community transmission rates and keeping them low is essential to support schools, other industries, other settings as well. I do want to emphasize that mask use in general, whenever we are indoor, and also where required in schools, is an important layer of protection, and one of the many layers that we must continue to practice through the fall and winter, as well as staying home if we're sick, physical distancing, washing our hands. And this will really continue to support us as we move into the fall and winter months. The Reopen Saskatchewan plan has details on what are all the measures that are required, including mask use and physical distancing for restaurants, bars, other sectors as well. So it's important again to be familiar with those sectors as we go about our daily business. And the back to school plans also include masks as one of the layers of protection, and where and how they're used is up to school divisions based on which phase they are in. And that again is guided by local community transmission, and if there were to be cases or clusters within the school setting. And again, we will continue to work with our colleagues, not just within Saskatchewan, but also across Canada and globally to, further understand what the issues are with COVID transmission, both at the community level and within schools. As we know, we've seen transmission increase in some provinces in Canada and also in many parts of the world where it had gone down. And thankfully, we haven't seen that in Saskatchewan, but we obviously need to continue to understand why transmission picks up and what measures we need to take proactively to prevent that from happening in Saskatchewan. And finally, we need to understand that, although some of us may feel a bit of a COVID fatigue, even though we've had, for the most part, a very nice summer, we've had low transmission rates, we've been able to enjoy the summer, we need to recognize that this is not forever. We are entering our first fall and winter during a pandemic, and hopefully we will be in a different place by spring and summer. I'll just end by saying that, we are at, very low transmission rates, but we can see from jurisdictions around us and internationally that it doesn't take much for transmission to pick up again significantly. So we really need to continue doing what we're doing to keep our case numbers low, to support school reopening, people going back to work, and all the other sectors of the economy that have been working throughout over the last few months, and hopefully will continue to do so in a way that supports economic activity, but also minimizes community transmission risk over the fall and winter months. Thank you.
Thank you, Dr. Shahab. We'll now go to the phone lines for questions. Operator?
We have Kyle Benning with Global.
Good afternoon, Dr. Shahab. In mid-April, there was about 9% of all cases were listed as untraceable. In the last few weeks here, we've seen that number go up to 30%. So are more resources needed for contact tracing so that we don't have as many untraceable cases, or do people need to keep a diary in keeping track of where they've been over the past 2 weeks, or are we sort of waiting for the contact tracing app that's being released by the federal government to be implemented in the province?
Yeah, I think that's an excellent point, and again, I think we need to emphasize in in the data that's available, what have we seen over the last 2 weeks. And like I said in a previous news conference, our overall, you're right, numbers of initially all the cases we saw in March, April were linked to international travel, and then over time we did see more community transmission, and of that, a proportion were settings where we could not find the exposure, and that's grown over time. So that's the cumulative number. But last week we had only a handful of our current active cases who we did not find a source of exposure. About a quarter to a third of our cases were linked to international or interprovincial travel. About a third of our cases were linked to exposure to another case, whether in the household setting or in a mass gathering or other setting. And there were very few cases, actually less than 5 over the last 2-3 weeks, that we have not been able to identify a source of exposure. And that's what we need to watch. I think we need to watch over a week-by-week period what proportion is linked to either interprovincial travel or international travel, what proportion is linked to specific activities. And again, we've found occasional cases in the past 2-3 months linked to a restaurant, a bar, but nothing consistent. And again, it speaks to the fact that businesses and customers are following the guidelines that are there. But we absolutely need to see how many cases continue to have no known source of exposure. But again, if you look at it on a week-by-week basis, it has been a handful, less than 5 out of 30 to 60 cases presenting a week. But I'll make a note of we need to show that information in a more detailed fashion or a week-by-week period, because like I said, the cumulative case numbers are one thing, but what happens the last 1 or 2 weeks, what informs us what we need to do over the next 1 or 2 weeks. I think that's going to be the cycle that we need to get used to.
Do you have a follow-up question, Kyle?
Yes, just on a different note here. There's now been a case at a long-term care facility here in Saskatchewan. As we've seen in other provinces, when the virus reaches into some of these care facilities, we get a lot more deaths and a lot more serious cases because of the elderly population. So is there something that can be done to limit the spread of the virus within these sort of facilities now that we already have one in the province?
Yeah, again, you're absolutely correct that, we have done really well to date in terms of preventing importation of COVID-19 into settings where people are more vulnerable, so long-term care facilities, personal care homes. I think the SHA has set up excellent protocols where staff are cohorted, there's appropriate use of PPE, and there were, unfortunately, with some challenges to families and loved ones, significant visitor restrictions. Now, those visitor restrictions have been relaxed, but where required, when there's an increase in community transmission, sometimes the visitor restrictions are, again, tightened up a bit if there's increase in community transmission. I think there's ongoing emphasis on staff screening and cohorting and other measures to minimize the importation of COVID and for a quick assessment with public health to contain COVID transmission. But I think that's an area that we continuously need to monitor as long as we're in a pandemic, as long as we're in our phase 5. And I'll just see if Scott has anything further to add to this.
Thanks, Dr. Shahab. So the only thing I would add is, because we do have a case in long-term care, we would have protocols for enhanced cleaning, also, isolating those residents as well, further isolation of those residents, and also ongoing screening of other residents inside the facility and staff on an ongoing basis to ensure that we're protecting everyone inside the facility, which includes wearing proper PPE for those staff that would be caring for that resident.
We'll take our next question on the line.
We have Mark Smith with CTV.
Hello. Today, 5 Regina businesses were listed in a potential exposure alert, and we've seen a large number of these alerts coming out over the past few weeks around the province. What do you attribute the number of these alerts that we're seeing to? What would be the reason that we're seeing so many of these alerts lately?
Yeah. So I think what we saw initially, of course, in March, April was travelers would come, they would be isolated for 2 weeks. they would not go anywhere, and there may be some secondary transmission to household contacts, but people would not be out and about. And then as we reopened, we did say that, if you are symptomatic, do not go out, do not go shopping or to other businesses. And for the most part, that has worked. But with more testing, sometimes, we do see cases who either had no symptoms or had very mild symptoms. And then public health does an assessment that in the day or two before you develop symptoms, where did you go? And if a person, because they were asymptomatic, did go to, just like all of us, to, a store or other business, we do realize that from what we've seen over the last 6 months, the risk of transmission in those settings is extremely low, even if someone was infectious and was to go to a retail location. The guidelines that we have currently, that all of us have to practice: physical distancing, mask use indoors, hand washing before and after coming back, not touching our eyes, nose, and mouth. I think those have served us well. But as an added precaution, these public service announcements are given just to ensure that if people were at a particular business, they can self-monitor themselves for a couple of weeks, and if they have any concerns, they can seek testing. But certainly, while the PSAs have been quite frequent as an extra layer of providing information, we have not really seen transmission in those settings, and certainly we'll be reviewing the value of those PSAs, because if you have a lot of PSAs, sometimes there's PSA fatigue as well. But transmission we have seen is not in the, if you pass by someone in a grocery store who was infectious, didn't know about it. Generally, we haven't seen transmission in those settings. Transmission really happens in close face-to-face contact, less than 2 meters. That happens for the most part in our personal gatherings or in a workplace where we aren't maintaining that physical distance. And I think that's where we need to, continue to do what we've been doing to keep transmission low.
Follow-up question, Mark?
Yes. In the report today, it says that weekly numbers of tests and cases for children under the age of 19 will be put together in a weekly report. Why is it going to be important to have that information separate from the daily updates?
Yeah, so when we did an initial analysis of testing by age group and positive cases by age group, we found that testing, is spread throughout the age groups, but it's highest in 20 to 40, and then second highest in 40 to 59, and that makes sense because these age groups are more likely to be out and about, working in healthcare and other essential services, now teaching in schools. But we also found that within that 0 to 19 age group, testing was a bit higher in that 15 to 19 age group, which is again good because, again, in that age group, you're more likely to be out and about. When we looked at case numbers, initially in March, April, we did see cases across the entire age range. And again, that was families coming back from international travel from sun holidays. Since that time, we haven't seen a large number of cases in that 0 to 19 age group, but through active case finding and active contact tracing, where whole households with a case were offered testing, like in the Northwest, we did see some cases in that 0 to 19 age group, but not too many. So thankfully, case numbers have been low, and again, as playgrounds opened and sports started over the summer, those case numbers have remained low, which is excellent. But now with schools opening, we are going to obviously look more closely at those age groups and break them up into preschool, elementary, and high school to understand more, is transmission increasing in those age groups, and what is the exposure setting? Is it within school, within community? Because after school activities may also pick up, and also testing is also going to increase because you're going back to school. Teachers are a priority for testing, but parents may, as they should, if a child is unwell, seek testing. So there'll be more testing in school-age children than we've seen before, which is a great thing. But we need to understand that if we see an increase in case numbers, what are the exposure settings?
We'll take our next question on the line. Operator?
We have Lisa Schick with CJME.
Hi. Is there anything that you can tell us about school-age tests right now instead of needing to wait until next week?
Yeah, I think we're trying to look at is testing picking up. We have some initial indicators that testing is picking up. And again, we have a lot of testing that happens, and we're trying to see if we can analyze testing by age groups and occupation. But again, that will give us some information. But then of the tests that are positive, again, obviously we want to understand better. But I think we would need to have to wait for how much information we can start sharing, from next week. I don't know, Scott, would you have anything to add to that?
Only that the teams are putting together that data now and starting to do so, and because we've identified beyond the age group for kids and school-age children, we're looking at tracking school employees, teachers, etc. So hopefully, the hope is early next week and on an ongoing basis we'll be able to improve reporting as we know more about what's going on with testing results and testing numbers in school-age kids as well as school employees.
Follow-up question, Lisa?
Yes, so you are planning, as well as having the numbers for school-age kids, you are planning on giving testing result numbers for people who work in schools?
Yeah, I think that is the aim as much as we can. But we do understand that, if you go for testing as a family, sometimes the occupations of everyone in the family isn't necessarily captured. So we'll see how useful that is. But certainly, I think, testing is easily available throughout Saskatchewan. And anyone with symptoms should seek testing. And it's especially important right now for households who may have a child in school or may have an adult who teaches or works in a school.
We'll take our next question on the line.
We have Adam Hunter with CBC.
Hi, good afternoon. Dr. Shahab, we see a few more groups online, and I know there's a couple of protests about anti-masks happening around the province this weekend. What's your message to these groups, and is this concerning? Because I know the advice is for people to wear masks.
Yeah, so, I fully empathize with people who may feel uncomfortable or shy putting on a mask, or may feel unhappy that we don't want to be told to put on a mask. And putting a mask on is a simple thing to do. You put it on, and when you're indoors in a public place, and then afterwards you take it off. So it's a simple act that our healthcare providers have been doing this for the last 7 months. Our people who work in grocery stores have been doing this without complaining for the last 7 months. As essential workplaces have opened up, employees have been doing this to show that they want to keep you safe. And it's been heartening to see as schools reopen, teachers and students were required putting a mask on, and in a very conscientious way. So I think this is something that, as well as physical distancing, hand washing, staying home when you're sick, it's worked well for us so far. It's kept, and what it says is that I'm keeping myself safe, but I'm protecting you as well. And it's a simple thing to do. And I've been saying that we haven't been so strong around mask use, and that's been fine over the summer. We've had our socialization outdoors on the beach where you don't really need to use a mask except maybe when you're going into the washroom. But now that we're moving indoors, I think we do need to pay more attention to this, because what we've learned from other parts of the world is that if you use a mask consistently in an indoor public place, you can significantly reduce transmission without having to go into mini lockdowns. And so if the choice is between keeping schools open, keeping businesses open, and doing the simple act of putting a mask on when indoors in a public place, versus having an increase in transmission, which may result in school closures or mini lockdowns, I think I would definitely recommend the simple act that that keeps everyone safe. And for people who aren't used to wearing a mask, certainly having it on for an hour or two indoors, I think is good. Even in workplaces, when you're at your workstation, you don't need to wear it. But if you're in an elevator or a stairwell, I think all it says is that I am keeping you safe, and I want you to keep me safe. That's all it is, and it's I think a generous gesture that adds another layer of protection.
Do you have another question, Adam?
Yeah, you mentioned that there's been evidence other places. What have we seen in Saskatchewan as far as industries or places where people have been wearing masks, and if there has been transmission while people are wearing masks? I'm thinking of healthcare facilities, restaurants, places where masks have been mandated.
Yeah. So I think Scott can add further, but certainly, healthcare workers have been at the front line, and we have, I think, 67 healthcare workers who have tested positive the last few months. And obviously, some of that exposure has been in the healthcare setting, both exposure from patients, but also exposure from, other staff. Some of it has been just like for everyone else in the community setting. But certainly, PPE in the healthcare field has been very effective in the ICU setting and long-term care, other facilities, in keeping staff safe and keeping patients and residents in long-term care facilities safe. What we talk about for the population is the reusable mask use, which again, initially, Canada, we were looking at the experience from Southeast Asia, other parts of the world. But, when you have high levels of community transmission, the evidence now is clear that this is not a medical mask, this is not a disposable mask, this is a reusable mask that you can make or purchase, and we will update our guidance on our website, which is easy to have and keep and reuse. And evidence has shown that while it's not a medical mask, the simple use of a mask actually by most people can reduce transmission risk out and about in a non-healthcare environment. And I think that's, again, in workplaces, we have seen that where there have been consistent mask use, when there's been a case or a cluster, it's been limited to only a few people, not impacting half the workforce. So it definitely has its advantages, but it's just one layer. We can't just use a mask. We have to do everything else, not go to work or school if you're sick, hand washing, maintaining as much physical distance as you can. And even in the workplace, we obviously, when we sit down for lunch with colleagues, maintaining that physical distancing, not sharing the food we brought for lunch. And it's hard to do when you work with colleagues you worked with for a long time. But I think masks are just one layer that is very effective, and we've seen that throughout our workplaces.
We'll take our next question on the line.
We have Zach Viseris with Star Phoenix.
Good afternoon, Dr. Shahab. Saskatchewan is very happily an outlier in Western Canada right now as we see the number of active COVID-19 cases climbing in Alberta, British Columbia, and in Manitoba. Many provinces are talking about this as potentially being the start of a second wave of COVID-19 infections. I'm wondering if that's something that the health system is actively planning for, and if so, what you're doing.
So maybe I'll also, after I've made my comments, ask Scott to speak to the readiness of the health system in terms of both testing and contact tracing, the SHA offensive strategy, and ICU and acute care bed capacity, the SHA defensive capacity. But again, you're right. I think, and I think all Saskatchewan residents should take credit for the fact that our numbers, they did go up a bit in March, April, then they came down really low, and as we reopened, we were expecting them to go up. They didn't as much as we thought they would, which is again, excellent use of guidelines by businesses and customers. And then they did go up a bit due to a variety of settings, outbreaks in communal living settings, an initial outbreak in the Northwest and in July, August, but then they've settled down again. So I think we are in a very good place right now with schools reopening. But, the key is how do we sustain that over fall and winter, and that's why, we need to think through that. What do we do in the fall and winter? And if we are with people who are not in a virtual household, how can we do those activities in a safer way? So, outdoor sports are continuing in September, October, November in a way that's safer. Some of the mini leagues have adapted to safer play. And then as indoor activities start, I think we just need to understand that how can we prevent, mass transmission event at, curling. And I know those sectors have done great work in how to restart play in a safer way. And, obviously there may be an occasional case in cluster and it's no one's fault, and we should understand that and learn from that. But I think with all these measures in place, we would like to see our transmission numbers remain low in the fall, but we need to constantly look and readjust our practices based on what we learn.
Scott, do you have anything to add on preparing for a second wave?
Yep. So just further to Dr. Shahab's comments, one of the things that, as you know, we've been doing since the start is focusing both on the offensive strategy, which is that public health response where we're, testing, assessment, contact tracing, and jumping on outbreaks as quickly as we can. And our experience in Saskatchewan, and Dr. Shahab has said this many times, we've been very lucky with respect to the number of hospitalizations, particularly the number of ICU patients we've had. So we're really fighting this COVID battle in the community right now, and it's how do we keep that community transmission low. We feel lucky right now as school started because it's everyone's business to keep transmission low in the community to make sure that our schools are safe, because transmission in schools follows what's happening in the community. But we have been actively and busily increasing capacity across all aspects of both that offensive response while hiring more staff to expand our testing capacity, or whether it's ensuring that we have acute care capacity. So although we're not in the news as much about having those concerns about PPE or the number of ventilators, we still are tracking all of that and ensuring that regardless of what comes our way, we're building capacity, preparing for a surge. And unfortunately, we don't have a crystal ball to know what that's going to look like, but we are actively and continue to prepare for that with respect to ensuring that we have the resources available to respond.
Do you have a follow-up question, Zach?
I do, for Dr. Shahab. Dr. Shahab, I've heard you mention the upcoming fall and winter a couple times, talking about activities that may look different this year. Can you give some examples of specific activities, events that you're worried about as potential sites or causes of transmission as we get into those colder months?
Yeah. So again, I think it's like seatbelt use, or safety while driving. Most accidents actually happen very close to your home while you're just doing a short run, not on those big road trips necessarily. And I think while we always think very thoughtfully about when we go shopping or when we go to get a haircut, and that's really important, and that's kept our case numbers low, is the familiar settings, with friends and family that we also have to think about. And, I did say that if you have a family member in your virtual household, not necessarily in your own household, who is now going to school, how do we reset the bubble to keep everyone safe? And then, winter is, summer is a time of barbecues outdoors, going to the beach or going to a lake or doing outdoor activities, and that has been a great summer, and it looks like a beautiful fall. But as we move indoors for a lot of our social events, I think just thinking through, how do we have those social events in a way that we remain connected socially, but maintain that physical distance, and other things around sharing food items where, instead of having a potluck or a buffet, having plated food. And I think the small things are going to be really important in the winter, and obviously we love to meet up with friends and family, but I think we just need to be very thoughtful about that and start planning ahead for the winter months about how do we keep connected, stay connected in the winter, but also be thoughtful about how do we minimize the risk of transmission.
We'll take our next question on the line.
We have Jeff Dandria with PA Now.
Hi, thanks again for taking my question. Businesses are trying to get back on their feet, but could face further challenges if employees need to take time off due to their kids at school, having to self-isolate if there's a case or outbreak in their class. So what advice would you give parents and employers at this time now that school is back in session?
Yeah, I think that's a really important point. So I understand schools have already said that obviously children especially are very keen to have perfect attendance, and schools have said that this time around, they'll take account of the fact that children may have to stay home several times during the fall and winter because, all of us, and children especially, get coughs and colds, and so if you have a cough or a cold, you should stay home till you're better, or if your COVID test is negative. So that will happen more frequently, and I think parents with children who are too young to stay home alone need to have a backup plan for that morning when a child is unwell and needs to stay home, about who will stay home with the child. So again, that's, and then because of that, I think employers have already supported staff staying home if they're unwell throughout the pandemic as people went back to work, but now that added layer of support for staff who may have a child sick who can't be home alone would be really important. So I think it's up to all of us to support each other during this time.
Do you have a follow-up question, Jeff?
No, I don't. That's awesome. Thank you.
Perfect. Thanks so much, everyone. That concludes today's press conference.